Hi, I'm Stephen Majors. I'm Vice President of Global Communications and Investor Relations with the Alliance for Regenerative Medicine. I'm honored to be joined today at ARM Studios by Tom Whitehead, who's the co-founder of the Emily Whitehead Foundation. Tom, thanks for joining us.
Yeah, thanks for having me.
Great. And most people are, of course, familiar with Emily's story, but why don't you just tell us about how you got involved in this field?
Okay, yeah, so my daughter Emily was born perfectly healthy up until just after her 5th birthday, and she was diagnosed with standard B-cell leukemia, and we tried our best to just do the chemotherapy regimen, but it failed her twice over 22 months. And then when we were going to be sent home on hospice, we called down the Children's Hospital of Philadelphia, and the CAR T-cell trial had opened the day before. So we transferred down there March 1st of 2012, and then she had to stay in her hospital room for 6 weeks while they genetically modified her T-cells in the lab down there, and then treated her on April 17th, 18th, and 19th of 12. And 23 days later, she became the first child in the world with her immune system trained to beat her cancer.
And so you're really focused on expanding access, I think, originally to CAR T treatment, but then just recently you've expanded your mission to focus on kind of cell and gene therapy overall.
Yeah, any advanced therapy, because we have those requests coming in from patients who autoimmune diseases, very rare diseases, just saying, do you know about an advanced therapy like you found for Emily for that? So we didn't want to limit, the impact we could have. And we were hearing from patients like Victoria Gray, who was the very first sickle cell patient, who reached out and just wanted to meet Emily. And we've been able to take Emily all over the world to meet maybe the first patient in Norway she met, and the first CAR T patient in Ireland. And we know when we do that, it spreads awareness, and it helps get these new treatments covered by the insurance, even if it's in another country where they have national insurance, but it might be somebody's decision whether they want to cover that or not. And we like to take Emily there to show them what the cure looks like.
And what do you find most frustrating on one hand, but also most hopeful about where the healthcare system now is in terms of delivering these types of treatments?
Well, currently it's very frustrating because it's probably the hardest since I've started helping patients for the last 13 years for patients to feel confident that they can find a trial or have success in finding a trial. And it's the first time that I've seen where some patients in the U.S. are going international to get into a treatment. But again, we just want to continue to have an impact and speak out even on policy sometimes to make sure that all the amazing people in this field that are working on these new breakthroughs are going to get the funding they need, and then make sure the patients and the doctors have enough education to know about sending their patients to these trials whenever standard treatment isn't working. That's our goal, education and accessibility, and when we're able to get some of these treatments out into the rural areas and smaller hospitals, you're going to have thousands and more successes like Emily.
Right. Well, I mean, we know that 80% of patients who are eligible for CAR T therapy don't end up getting the treatment for any number of reasons. Can you tell us a little bit about some of the conversations you have with parents whose kids are in similar situations to what Emily was in, and what they talk to you about, what kind of help they're asking for?
Yeah, so when they first reach out, a lot of times they're just very frustrated because they applied to their insurance to be able to go to one of these treatments, and it's instantly denied if they don't know about them or know what's going on. And a lot of patients and parents don't know that you can file an appeal and push back and say, this could be curative for my child or my husband or wife or my loved one, and then talk the insurance company into it. That's what we had to do to get ours covered. So I know all about that, but I think, when the insurance companies are brought into the conversation and they're more educated on what it is, and it becomes, in their eyes, more economical, it'll also lead to more approvals and then more patients getting treated.
And what kind of progress have you seen over the last 5-10 years? And then if you look out 5 or 10 years from now, where do you hope to see things in terms of the ability to access these types of therapies?
Yeah, well, like you said, there's still 80% of the patients aren't getting into it, but there's so many more that are because it's become more accessible. I mean, in the very beginning, all the patients that reached out to me had to come to Philadelphia. We had to try to figure out a way to help them get to Philadelphia to try to get treated. And now I think Emily's treatment alone is available in over 100 hospitals in the U.S. And internationally, I think there's been patients in over 70 countries treated. So that's come a long way, but there's still a long way to go for the patients in need. And when the new breakthroughs happen, like in solid tumors and that, there'll be so many patients that there'll be waiting lists all over. So we're trying to be a part of it now, is to help the industry figure out how you could treat those patients and hopefully convince the politicians in that control the funds from the government that it's worth funding so that we can get those patients treated.
That's great. Well, thank you for all the great work you do for all the patients out there, and we appreciate your support of ARM and for joining us at Meeting on the Mesa and for joining us here at ARM Studio. So thanks a lot,
Yeah,
Tom.
and honestly, we're very thankful for what you all do, because what you're doing is saving lives all over the world.
Well, thanks so much.
Hey, thanks.
All right.
Yeah.
Appreciate it, Tom.